Welcome to xMatters Demo Days. Thank you for joining us. As a customer success manager here at xMatters, I'm excited today to be talking to one of the customers that I work with, University of Kentucky Healthcare. You'll hear about how they're achieving success with xMatters. We have the chat area open for you to post comments or questions throughout today's webinar. This session is intended for xMatters customers or prospective customers. It is subject to all published fair use policies and other terms and conditions. If you'd like more information, you can find it at xmatters.com/policy. Be sure to stick around until the end of the webinar. I'm your host, Sonu Sekhon, and joining me from UK Healthcare is Glenn Steketee. UK Healthcare is the largest hospital in Kentucky and committed to academic healthcare. Glenn and the Service Management Group maintain the policies, processes, and procedures for the IT organization, supporting the physicians and medical staff in providing cutting-edge services and patient-centered care. With revenue over $12 billion and over 15,000 employees, UK Healthcare is rated the best hospital in Kentucky 6 years in a row and is one of the top transfer centers in the country. We're also joined by xMatters product advocate Will Derksen, who will be showcasing some of the xMatters features that UK Healthcare have used to achieve their success. So Glenn, welcome and thank you for joining us today. As a valued customer, how long have you been using xMatters?
We started using xMatters February of 2013.
Great. And what was your primary need for implementing xMatters?
In February of 2013, we started using an on-prem version of xMatters that was designed to notify doctors and clinicians of code blue paging. So we had previously had to use a overhead call monitoring system throughout the hospital. We were building different new areas of the hospital, and we needed a better way to ensure that the code blue pages were delivered. So we were looking for a product that would fit our needs, and we came down to xMatters. And that's what we were using it for to begin with, was for code blue paging of trauma events.
So it sounds like xMatters help you automate the notification process for trauma events. How have your needs changed over the years, and how has that process changed?
Well, after we got the on-prem version done, and we called it code paging is what it was, for code blue pages, we started looking at ways to help. Maybe, hey, we could use this product for our IT notifications, because at the time we were using a very antiquated way of notifying our IT on-call people. We would actually have to call into a service desk, submit a ticket, an incident ticket, then the service desk would have to go to SharePoint, pull up a list in SharePoint to find out who the on-call person was for that group. And then they would have to manually dial their phone, or we had pagers. And this is going back to 2013, and we were still using pagers. And hopefully you were within the service area to be notified of the page. Not a very good way of doing things, and we wanted to make that better. So then we looked at xMatters to implement the automation of notifying people, and that's when we started using it in our IT organization, and that was in late 2013.
Like many organizations, we've known you've gone through a digital transformation process. How has your use of the platform evolved since implementation?
So, I mean, it has grown. Back in 2013, we were using a product called Remedy. I'm sure many people have heard of Remedy before, BMC's Remedy. And we didn't have it integrated at all. So we were getting notifications on incident tickets, but that was about it. That's all we used it for, was just a notification tool. So then in 2017, we began thinking of ways to make this product tie into our ticketing system. We opened, and now we're using ServiceNow. So we have the integration piece with ServiceNow. Everything is automated. Setting up of users where it used to be manual in xMatters, we've got that tied in with an identity management tool that sets users up, automatically defines at least a few of the devices that they have in xMatters. So the automation piece has come, I mean, it's leaps and bounds.
You mentioned integrations were key for you in that process. What integrations did you create with xMatters?
Well, first we had the integration with ServiceNow, and then we have also used the email integration piece. With the email integration, one of the teams was asking, hey, we have these servers that we're receiving server notifications, and we would like to see if xMatters could send us a notification through an email trigger. So we've set up the email integration piece, and this has cut what this group does. It's our systems integration group. They have medical devices that they can tell if something's about to go wrong. So what they do is they'll have this server send an email into xMatters, and it will now notify all of their devices, where previously all they would get was a page. And we have a very limited pager coverage area, so sometimes the on-call person would never get the page. It has reduced their response time down on average from 4 to 5 minutes down to 20 seconds. And when you're talking about a medical device integration piece, that's where, you know, minutes matter in a healthcare environment, and this has greatly reduced the response time.
Great.
Teams is another integration that we have used. We just did that maybe about a year ago. We've got the integration with Teams so that now if any time an incident goes to critical status, we have a Teams channel designated to host messages, and any collaboration that we have, we can host that and post that in Teams. And it's just a good way to collaborate all in one, and people get notified of it as well. Other means, but we do have that Teams channel now as well.
Some of our attendees will be in the process of evaluating a solution like xMatters and likely have a number of metrics and goals in mind. Has the xMatters solution saved money or increased productivity for your teams? And what are the top 2 to 3 benefits of using xMatters?
You know, as far as saving money goes, I'm assuming it has, but when we're working in a healthcare environment, it's not necessarily, and I don't mean, this may sound cliche, it's not necessarily money, but it could be a life that you're saving. And when we've taken our response time down on incidents from having to review a SharePoint spreadsheet to having that thing trigger virtually immediately, I mean, it's almost immediate. It's a savings that you can't really put down a dollar amount because we're talking lives. Now, if you want to say time for working, now it has saved a lot of people time in working because they're able to get to something. They're able to even respond on an app. You talk about doing that in 2013. You didn't have that ability, so they can do stuff when they're away from their desk, away from their computer, because they have so many things in an app, and xMatters is one of them.
Yeah, those are great improvements. Can you measure that in a response time improvement? You mentioned responses can be delivered from the app and various sources now.
Yeah, well, yeah, you can collaborate, you know, send something right to it using the quick messaging. You can have, if you're the on-call person, you're away. It used to be that you would have to let calls roll. Well, everybody has the app on their phone, the xMatters app. Using the quick messaging feature, you can immediately contact someone and say, hey, grab this for me. I can't get to it right now. So the response time is down to, you know, probably less than 30 seconds for something. We're on it. You know, if it's a higher critical priority event, we're on it quick.
Thanks, Glenn. I appreciate you
Mhm.
sharing your journey. For our attendees, we know
Sure.
that seeing is believing, so let's pivot over to Will and have a look at xMatters in action.
Yeah, thanks, Sonu. I'm going to go ahead and share my screen here quick. Thank you.
Mhm.
So yeah, Glenn has told us about some of their key integrations with ServiceNow, Teams, and xMatters Incident Management, as well as how, we've helped UK Healthcare get all of their stakeholders on a conference call. We're going to take a look at how that's actually orchestrated from ServiceNow as the entry point. So I have a incident ready to be created here, and we're going to go ahead and submit. And what that's going to do then is use our integration to go in on the back end and look at this major incident management group. And then we're going to find out who is on call. And we're going to go ahead and page that person out. So we can see as things are rolling, our activity stream is updating in real time. For UK Health specifically, what we're looking at is our incident alert outbound status, when that status is now changed to active. From there, we're looking at our major incident state. Once that has been accepted, we're creating an online meeting with teams, initiating an incident, creating a channel, and then posting a message to that channel, that dedicated channel for the incident. Then if our priority has been set to critical, we're creating a channel automatically. So we're just got some more automation happening on the back end here, and then posting that message with that alert information. We're going to go ahead and pivot over to my alerts. We should see one come through here shortly. So we can go ahead and look at this, and this is the information that's coming directly from ServiceNow. We can see that we have our details, a link to the incident, our related incidents that might give us some idea of what's going on. And then we can see here that we have our Teams channel and our status page for stakeholders. We also have the ability to then create responses that we can utilize as an extra workflows. So we can accept, assign it, resolve, escalate, and in this instance, restart a pipeline. But we're going to go ahead and assign that over to me. We'll respond now and jump back over to our incident, and we can see all of those different devices that have been notified. And once it links up, we can see here now that I have been assigned that ticket out, and the state has been changed dynamically to in progress. Now, once this has all kind of come to a close, we can go to that same notification and resolve from the app. So kind of bringing it whole picture from the place that your employees know how to work and where to work from, adding that value to go and actually do all of that work on the back end. So Sonu, yeah, that's all for me from the demo perspective. I'll turn it back over to you.
Thanks, Will, for the tour through some of xMatters automation functionality, which has helped Glenn's team support their users. We've seen just how powerful xMatters can be in instant response. What's next in your digital transformation journey?
Yeah, Sonu, what we've done is about 2 weeks ago, as you know, we have implemented major incident management within ServiceNow, and we are really excited about it because it has enabled us to do a few things that we've been wanting to do for quite some time. Sorry, I'll share this here. What we're doing is now we're using Teams audio and a conferencing bridge for anything that we determine is a major incident. And we're managing that out of the incident console within xMatters. It lets us know with a quick view of who's being engaged, were they notified, stuff that you could always have access to, but within that incident panel, it's right there on the same page, so you know who to expect on a call. Hey, do we need to stop trying to notify them and notify somebody else? And it's all visible right there. The integration pieces with Teams and xMatters have just been phenomenal so far. We're excited about it.
Excellent. We look forward to sharing in that journey with you.
Mm-hmm.
So as we bring this session to a close, let's recap some of the benefits that UK Healthcare has realized with xMatters. Cost and time savings in healthcare, fewer failures and quicker response from being able to reach doctors and on-call medical staff with automated escalations, better reporting and quicker engagement during major incidents, and finally, the overall time savings that come with process automation. Now let's take some questions from the audience. First question here for you, Glenn. What was the hardest part of getting started with xMatters?
So we go back to February of 2013, and how I was introduced to xMatters is my boss at the time sent me an email with a PDF version of a user manual for xMatters. So it was something that I had to learn. My teammate and we basically learned it on our own, and it was hit and miss. But I'll be honest with you, once you get in and start working with it, and I truly mean this, it is very easy. But the hardest part, I would say, if I have to say one thing, is when you don't have an automation set up and you have to manually set up users. It's not difficult, it's just time consuming. So if you're gonna do it and you have the ability to do it, I would definitely set up a way to integrate users so those are automatically done. But everything else has been truly easy. It really is.
Thanks, Glenn. Another question here. Does it take up much time administrating the xMatters platform?
These days, no. It really doesn't. Don't want my boss to know that, but it is very easy, especially since we have the integration where it sets up the users. I would say the only thing that would take any time is if you have certain groups. Most of our IT groups use the same on-call schedule and rotation philosophy, but there are some that want something a little different. And just sitting down and working with the manager or the group supervisor and coming up with an on-call rotation that works for them. That's probably the most time consuming. But that's part of doing your job, helping them out, benefit from the product.
Great,
Because
thanks,
the
Glenn.
on-call schedules are so flexible. You can do what you want.
Yeah. Well, thanks, Glenn. That's all the questions we have. So if you liked what you saw today, thank you. You can try yourself with xMatters free. Sign up today at xmatters.com/signup. Or if you'd like a personal demo, you can request it from one of our experts. You can do so at xmatters.com/demo. If you found this webinar interesting, we have more webinars scheduled every month. Sign up on our Demo Days webpage. You can also track us down online, follow on your channel of choice, Twitter, LinkedIn, and Facebook, where we share even more, and would love to connect with you. Thank you, Will, for guiding us through the demonstration of xMatters, and of course, an extra special thank you to Glenn Steketee from UK Healthcare for sharing your journey with us today. And to our guests, thank you for joining us. This concludes today's Demo Days event. Have a wonderful day.